Welcome back. I'm Chesna Alexander. Our topic today is National Osteoarthritis Awareness. In studio with us is Mike Body, and before the break we were talking about treatments for osteoarthritis. Thank you again, Mike, for being here. We were discussing the different treatments, and you mentioned there are 3 treatments?
There are basically 3 modes of treatment. By and large, osteoarthritis, as it progresses through life, you can only really control the pain.
So there's
there's no cure for it. Put it that way. There's no cure for it at all. Normally, what happens is you will go to your GP, who will then probably refer you to your rheumatologist.
Okay.
A rheumatologist is basically a doctor or physician that specializes in the rheumatic diseases or conditions, osteoarthritis being one of them. Unfortunately, with osteoarthritis, it's largely about pain control, lifestyle, and looking after yourself. Doctors will probably treat you with what they call analgesics, which are used for pain control, painkillers, etc., etc. They will then, depending on your own particular diagnosis, because there are various stages of osteoarthritis and no one particular person can be treated in exactly the same manner. So let's be clear about that. Okay. So because one person is being treated in one manner doesn't mean that another person is going to be treated in exactly the same way. But by and large, osteoarthritis is about treating pain. Initially it can be quite painful. And then as time goes by, it can get to be a dull ache, or it can get more painful, or it can even just get to a point where your mobility is limited, but with no pain. So it varies. Okay. However, if there is inflammation and there is pain, they will use what are called non-steroidal anti-inflammatory drugs, NSAIDs.
Okay.
That is largely to reduce pain and also to reduce inflammation. Another treatment that they would give you is a steroid injection that would require an injection into the joint, and hopefully the inflammation would reduce rather dramatically thereafter. But by and large, as I said, the treatment varies from person to person, patient to patient, and one would have to go to your rheumatologist or your GP or a physician to get a proper diagnosis and proper treatment.
Is it preventable at all? You mentioned it's not curable, but is it something that can be prevented? Does the healthy lifestyle from an early age help reduce your chances of getting it?
At the end of the day, it is a wear and tear form of arthritis.
Okay.
Put it this way, if you have an old injury, a sports injury perhaps, or you've been doing some kind of work where you perhaps are lifting cement bags, heavy objects, drums, this sort of thing, and perhaps you've been doing this continuously all your life, obviously wear and tear, you're using your joints far more than what the ordinary person would. Okay. So with wear and tear over a period of years, you would become aware of maybe aches in the morning, creaky joints. You would not feel quite yourself at all, and that's the time when you would actually take yourself off to your GP, who would then refer you to a physician, a rheumatologist, etc., etc., and then they would take it from there and give you an actual diagnosis
on it. So there's really no set way of
look. You can live a lifestyle that will help the symptoms of the osteoarthritis. For example's sake, eat in a healthy manner. Don't overeat. I always say, when you're doing something, don't go to extremes. A lot of people will say diet. Other people will sort of binge.
All in moderation.
In a moderation, steer a middle of the road path with regards to diet. Eat healthily. Don't eat too much. Keep your weight to what it should be for your frame, for your stature.
Exercise?
Try and avoid becoming overweight, because the more overweight you are, the more weight, obviously, you are going to put on weight-bearing joints. And obviously, the wear and tear will increase, especially if the joint has been damaged over a period of years. You're just putting more pressure on the joints. So it's obviously wise to keep your weight down. So lifestyle, yes, eat properly, keep your weight down. You mentioned exercise, yes. Exercise is extremely good for any form of arthritis, especially osteoarthritis. Although initially, if you do exercise, it probably will be painful because you're not used to the exercise at all.
Okay. Are there any specific exercises that you could think of for someone at home that is thinking, like, I've got joint pains, I'm not sure if I have it? Because a lot of times we try and self-diagnose and we say things like, it's winter, it's the cold weather, and things like that. Is there anything...
Okay, if I can perhaps just start off by explaining, I'm sure many of the viewers and perhaps yourself have asked yourself the question, why would I be sitting here saying that exercise is good, especially when the joint is bad?
Yeah.
The reason for that is that because in the instance of osteoarthritis, your joint has become, the cartilage has become eroded, and perhaps in many cases the bone is touching bone. The cavity in which the joint operates has actually become less firm. It's wobbly almost. Okay, if I can describe it as such. The tendons, the muscles around that joint, if they are firm, they stand a greater chance of actually keeping the joint connected, so to speak, and to stop it from wobbling around. If the muscles, tendons around that joint are slack and are not toned, the joint has far more of a chance of still carrying on wobbling, moving, etc., etc. So that's the one reason why we actually recommend exercise in the case of osteoarthritis, and for that matter any other arthritis. The type of exercise that one would recommend is any type of exercise that doesn't require or doesn't have impact.
In other words, no push-ups.
In other words, jumping, star jumps, anything that has impact, where it's going to jar the joint. Swimming is extremely good. If one can have access to perhaps a heated swimming pool, even if it isn't heated, the very fact that you're in the water
and moving your body,
you're buoyant, you're moving around, your muscles are all moving, that is extremely good because you're firming the muscles around the joint, and of course you're preventing further possible damage to the joint. So yes, exercise is very good, as strange as it might sound. Cycling is also quite good.
Because there's no impact.
There's no impact at all.
So before we continue, I also wanted to touch on you mentioned your organization having support structures in place. We're just going to a break, so when we get back from the break, we want to just catch up on that. Please stay tuned. We are busy discussing the National Osteoarthritis Awareness Day, and when we get back, we'll discuss support around that situation.